My name is Serena Saade. I'm a PGY1 resident at ABMC, and I want to start by thanking you for being our second guest speaker for the Medical Student Wellness newsletter. So, this year was challenging for everyone, but we all know that your department was at the front line, first during the catastrophic August blast, then having to deal with the surge of COVID patients in a pandemic that's still going on. How did you deal with the acute massive stressor of August 4th, and how are you still dealing with the chronic stressor of the pandemic?
Yeah, so actually you point on a very important issue, which is that the ED has been front and center of a lot of the stressors that Lebanon has been going through for the past year and a half. Even before the August 4th blast, there was the civil unrests, and our teams would have to get through roadblocks to get to work and care for the patients, the flood of casualties that we were seeing on a regular basis. Then came the pandemic and August 4th, and then the surge, especially in the past recent months of COVID. So it certainly has been a very, I think, difficult year for people working at the front lines, whether in RED or anywhere. And I think the biggest challenge has been really moving to crisis standards of care, especially on August 4th. I think as physicians, we are taught and trained to be perfectionists in what we do and to follow very strict protocols and systematic way of doing things and not doing shortcuts. And of course, when you're faced with large number of patients, whether it's in a pandemic surge or in a blast situation, a mass casualty situation, you have to move to crisis standards of care where you have to decide on where resources go. And I think that was very difficult for everybody, especially on August 4th, but even in January and February when we had to care for patients, significant number of patients in the ED who couldn't get rooms in the inpatient side. Certainly it left a toll. It left a toll on everybody. It left a toll on me because you remember the patients that you see and how you had to make those decisions and question, were they right decisions? Could I have done it better? And I think getting past that stress, whether it's pandemic or blast, it's important to recognize that these are normal feelings, that resources are stretched in these situations, and that everybody does their best. And that is what we all did. We all did our best. And I think that talking about that and talking about how normal it is to feel, to have the self-doubt, to carry that moral injury of questioning decisions is important to realize that this is normal. These are normal feelings, and talking about them and getting past them. And realizing that we all know that everybody did their best, whether it was on August 4th or whether it was January, February during the surge. And the impact of that was that we did manage to care for a tremendous number of patients with no mortality or morbidities from the work that we did. And I think that really was Herculean effort from the team. It's just that when you are amidst it, it's hard to see it. And once you're past it, you realize, wow, we were able to do that. And it was a tough period.
So, being the chairperson of the emergency department at ABMC, but also a mom and a wife, how do you maintain a good work-life balance while finding time for self-care?
Yeah, I think it's a hard era that we're in, where technology has made it very easy for work to spill over into personal life and personal life to spill over into work. And when you start with technology and this promise of flexibility and being able to manage so many things, you try to merge those together quite a bit. You allow your personal life to get into work through texts and WhatsApps and whatever it may be, and the opposite. When you're in your personal life, you're constantly trying to keep up with the professional life as well. And I think that ultimately, this is what leads to burnout. So over the past few years, I think as not just individually, but as a department, we've decided to try to compartmentalize more our work so that there's less of this spillover on both ways. How do we do that? It's by trying to agree collectively that we will not email each other. We will not text each other about things that are work-related and are off times. And I think that's helpful, is if as a group, the people you're working with all come to some standard way of communicating with technology in a way that compartmentalizes your personal and your professional work. I think that was very important for me to end up finding some sort of peace with both being at work and my time at home.
Okay. Going back to when you were a medical student, did you always work with the aim of reaching the position you are in now? And if yes, how stressful was it for you to try to exceed the expectations of your community and maybe even your family?
I think most people who go into emergency medicine have this aversion to planning. So, no, certainly I did not plan this path. I think it was, at least for me, important to ultimately do the thing that I felt most passionate about and do the best I can in all the responsibilities and roles that that opened up and that were placed on my shoulders. And I'm happy with where it has led to, and I'm happy for being redirected in a different path if that's what ends up opening up. So I think it's really trying to find your passion and seeing what life offers in terms of opportunities.
Okay. And finally, any advice to the current medical students and future female physicians in particular on how to complete their education while paying enough attention to their wellness and mental health?
I think one of the most important things, male, female, women, men, is really we have a very long training path. So coming to terms with that and seeing it as part of the journey as opposed to waiting for things that you want to do till after residency or after med school is important. So whether it's traveling in med school or whether it's having kids or having a family, whatever it may be for the individual, but not holding up life, basically. So don't hold up your life till post-residency or post-med school or post-fellowship. Really just embrace it and you will find your balance ultimately. There is no perfect time to enjoy the things that you want to enjoy or to live your life. So you might as well do it throughout the journey of training. Don't wait for things till post completion of all the training.
Okay, thank you very much.